My name is Dr. Faye Short. I'm a reader at Bangor University and I'm also the Deputy Head of School responsible for teaching and learning. I'm a lecturer here. I teach social psychology and I teach counselling and psychotherapy. And I actually did my undergraduate degree in psychology, my master's in psych research and my PhD all at Bangor University, and then moved away to do some teaching and then came back to be a lecturer here. The difference is very, very difficult to distinguish. It is very much overlapped, and if you look online on things like NHS jobs, you're going to see a lot of jobs that are requiring either or. So in both cases you might work with patient populations or you might work with non-patients or clients. In both cases you may work with severe mental health disorders. In general, you might see clinical psychologists working in cases like head trauma or stroke, whereas with counselling psychologists you're probably looking at more mental health issues, perhaps schizophrenia, perhaps significant depression, bipolar disorder, those kinds of disorders. A bigger distinction that you will probably see is the distinction between counselling psychology and counselling, because they sit separately. So counselling psychology is somebody who has a doctorate in counselling. It's a legally protected title, and they will usually work possibly with a patient population. They'll be hired with the NHS at a higher tier, so a higher level of pay and a higher level of responsibility. In contrast, counsellors may be accredited by the BACP, the British Association of Counselling and Psychotherapy, so they may not be a psychologist, they may be a counsellor, which is slightly different. They wouldn't necessarily have a doctorate, they may have a master's in counselling instead of a doctorate, and they may work with more client bases, so what we often term as the worried well, possibly in schools, in universities, in employment places or in private practice, sometimes working with the NHS, sometimes working with those tiers of individuals who need support but perhaps aren't at the patient level. I think it's difficult to identify specific personality traits because it's hard to say whether things like empathy and a non-judgmental approach and an understanding nature are personality traits or things that we can develop. I think it's important to demonstrate patience, to demonstrate empathy for your clients, to strive to see the world from their perspective while maintaining your own sense of identity and protecting yourself. It's important to not to be judgmental and to be able to look at things from the client's viewpoint and at the same time be able to hold on to those boundaries and be able to actually offer that support, and sometimes to be quite challenging. Whether those things are personality traits or things that we can help you to develop through training is a question that I suspect is hotly debated across psychology, but I think those are the main traits of effective therapists. Pretty much anyone. So you may be working with individuals who have diagnosed mental health disorders. You may be working with a client base of people who are classed as perhaps the worried well, so people who are experiencing anxiety or low mood but haven't had a diagnosed disorder. You may work with children, or you may work with teenagers, adolescents. You may work with adults. You may work with older adults. You may also work with groups, possibly with family groups or with couples. It's possible that you would work with groups in an employment environment, working in that sort of industry. So there's all kinds of different groups of individuals you could be working with. You could also be working with people in a university setting who are students, or you could be working with pupils in a school. So I really think that you could be working with anybody across an entire spectrum of human beings. The question really is whether these people require support and require that listening ear, that person who can challenge them, support them and guide them towards their own self-well-being. There's a lot of opportunities out there, but they can be very challenging because they can be very competitive to access. And I think what you will often find is that in order to be able to get accredited, you need a certain number of volunteer hours. Technically not volunteer hours, you need a certain number of placement hours in practice in face-to-face counselling. However, it's difficult to get those because there are so many people striving to get accredited, and so there are a lot of people out there seeking this work. However, counselling and psychotherapy is a growing field. We recognise that there are huge numbers of people who are seeking help where we do not have the resources to provide for them. So we're seeing a massive commitment from the NHS to increase mental health support, so we may see more volunteer opportunities through them. There's also a lot of volunteer organisations out there who offer to train and support you. In general, they will be looking for somebody who is on a training course. So somebody who's perhaps doing a master's in counselling, and then they'll do a placement as well, because then they feel confident that you're getting the training you need and the support you need from the course, as well as doing the placement with them. So it can be harder to get the experience before you get on a course. Exceptionally important. It is a core requirement of the British Association for Counselling and Psychotherapy's ethical guidelines. It's a core requirement for the British Psychological Society ethical guidelines. You are required to undertake a period of professional development every single year. So you have to go on courses, you have to extend your practice in terms of learning more, engaging in research if possible. All of these things will make you a better practitioner. The world doesn't stop. You don't learn everything you need to know about psychology or any other subject and then say, I now have it all, I can just work. In almost every field now, you need to be constantly developing in order to ensure that you're at the cutting edge of your profession. I think the major challenges are maintaining your boundaries, because you may encounter people who have exceptional hardship and difficulties, and you will feel a natural human empathy and you will want to help them and support them. And sometimes what you need to be able to do is to protect yourself, to take that step back, and to actually allow them to find their own solutions. And it can be very tempting, particularly for inexperienced or new counsellors, to race in and want to solve the problem for somebody, especially if you think you know what the solution might be. But the reality is, we don't know that person's life, and it's important that we are able to allow them to find their own path. Otherwise, they are always going to be seeking help from somebody when they hit a challenge, if they never have an opportunity to learn how to meet the challenge themselves. So I think that can be one of the hardest things as a therapist, to take that step back, maintain my boundaries, and allow somebody to find their own way, even if that's quite difficult for them. Of course, that goes hand in hand with one of the best things about this job. When somebody is finding their own way and has managed to overcome some of the challenges in their lives, then that can be an amazing experience. That gives you something completely unique. And knowing that you were there, not solving the problem for them, not making them get to that solution, but at their side while they were finding that solution, is an absolute honour. Yes, so at the moment we are in pre-validation, so we are just pulling together the paperwork for validation, and so at this point I can't absolutely confirm that any of the plans will go ahead as I'm about to describe them, because it is entirely possible that during validation we make extensive changes. But the programme as it currently exists looks like it will run over 2 years, and it will run for 2 semesters per year, so it won't run through the summer. The idea of the 2 years is that it gives you a sufficient amount of contact time with academics and a sufficient amount of time to get your placement hours. So to be accredited by the British Association for Counsellors and Psychotherapies, you have to have had a certain number of placement hours, and that number is very high. And to expect you to have had the number of hours in contact with staff, teaching hours, and then to have had the placement hours all within 1 year is completely overwhelming and doesn't give you the opportunity to develop those personal skills that I mentioned earlier. So the idea would be that you, through the first semester, are in training with us, and then you start your placement after Christmas in the first year. Your placement then runs for a full year, and Christmas the following year, in your second year, you would come off your placement, giving you a last few months to catch up if you've managed to miss some hours. If your clients didn't turn up to certain sessions, you can catch up on the remaining hours so that you have all your placement hours. The course itself in the first year will cover everything on the diploma, so it will give you everything you need to get your diploma and be recognised as a fully trained counsellor. We cover everything that the BACP requires and everything that the QAA benchmarks require. So you will learn about the different approaches in psychotherapy, you'll learn about the different models, you'll learn about the different techniques, you'll learn about the importance of the relationship, the ethics. We'll cover research methods in counselling and psychotherapy, we'll cover communication skills, we'll cover skills for actual counsellors in practice. We cover all of that, including things like mental health, assessment, diagnoses, all of those elements that are absolutely essential. At the end of the first year, you will then move into your second year, and that second year will be comprised of a research project where you will conduct a piece of research looking at the effectiveness of counselling and psychotherapy, and 2 more modules. So those 2 modules will be anything from our suite of modules that we currently hold in psychology. So it may be that you choose to do a module in mindfulness, a module in ABA, a module in developmental. So at the end, you would actually be graduating not just with a master's in psychology, with a fantastic research background, but also with this specialism in a particular area that will give you that edge when you start going into interviews. And you would have covered all of your placement hours that are required. The master's course will be full-time across the 2 years, but it won't be a full 180 credits per year. It will be fewer credits, but it will be just enough to give you full-time so that hopefully you would then be able to access funding if you need funding, or it will meet all the visa requirements for full-time status as a student, which is important for our students. But it will also give you that time that you need in order to develop professionally and personally while you're going through the course.